if we step back to, let's say, February of 2020, how dangerous a disease is COVID? And then the same question for the present day to a doctor like you who has experience and all the tools necessary at their disposal.
For an infection, there probably is no other infection that we now understand is so amenable to risk stratification. How can the same viral infection be fatal in an octogenarian and have it be less than a common cold in a kindergarten-aged child? The principle of that's called risk stratification. It's actually probably due to the density of ACE2 receptors in the human body. The virus actually gains entry into the human body through the ACE2 receptor and to a lesser extent the TMPRSS2 receptor. It turns out that we have a lesser density of ACE2 receptors in older individuals, those who are smokers and diseased. But the virus the number of receptors doesn't matter in terms of entry, but the number of receptors that actually exist, since they're destroyed by the entry, the sheer number provides protection against basically a catastrophe in the lungs, what's called the respiratory distress syndrome. We also know that the proclivity for blood clotting increases over time. There's thousands of determinants of coagulation. And the very unique thing about this virus is that the mode of death is micro blood clots that occur throughout the body, the lungs, and there are fatal thromboembolic consequences. Almost every autopsy I'm aware of, Bret, has shown the lungs are filled with blood clots at the time of death. So it's the idea that risk stratification is so huge, and so it can be very deadly in an octogenarian and is completely benign in a school-aged children. That risk stratification must be applied with every single inference we make in the pandemic.
Yeah, that's fascinating. And it is obviously at odds with a public health response that seems to be one size fits all, almost to a cartoonish degree. The idea that vaccines are inherently the right response, that the fact that these vaccines are incredibly novel at a technological level, they are a marvel, but they are novel. And the idea that we should be interested in immediately vaccinating the entire world if we can reach them with these novel technologies, effectively dragging the entire human species into what I would call an irresponsibly uncontrolled experiment, seems preposterous. I mean, as you point out, very young, healthy children are effectively at zero risk from COVID. Is that a fair statement?
It's a fair statement. We've looked at, obviously, we're at now in the last two meetings with the FDA on the pediatric and adolescent vaccination, September and October of 2021. There's a general recognition through May that 40% of children have already had COVID-19. That's through May. That's before the Delta outbreak. The Delta outbreak was huge in the United States. You know, it was 2/3 of the peak of our pre-vaccination peak. And we know there it actually seemed to prey upon the young. And so my estimate would be, I would put a number on it, 80% of children now that are in the discussion for vaccination have already had COVID. And now the CDC in the last week has acknowledged that they don't have a single case of someone who has recovered from COVID, getting it a second time and passing to anyone. So it's basically over with. We have now, the CDC estimates are generally for the United States, 148 million Americans through May are immune, that they actually have had COVID-19 and they have natural immunity. That's now supported by over 120 studies. That's being, by the way, accumulated on the Brownstone Institute website, 120 studies supporting natural immunity. It's a one and done phenomenon. The only confusion that exists out there is a second positive test that can happen as a false positive test, and some early confusion on the original CDC assay not being able to distinguish between flu and COVID-19. But in terms of scientific reality, one only gets COVID-19 infection once. The immunity is robust, complete, and durable, just like SARS-CoV-1. They're 90% similar as the virus. That natural immunity is going to carry us. And you're right, the public health response has not been along the lines of risk stratification as it is with other vaccines. we don't carpet bomb the entire population for the meningococcal vaccine. It's kids who go to college and live in dormitories get the meningococcal vaccine. Americans don't have a problem with that because it's safe and effective and it's appropriately risk stratified. The same thing with the pneumococcal vaccine. We give the pneumococcal vaccine to seniors because they're at risk for pneumococcal pneumonia. We don't give it to children because they're not at risk. The same risk stratification principles for other vaccines should have always been applied to the COVID-19 vaccines.
Yes, it looks to me, and of course, I'm a scientist, not a medical doctor, but it looks to me like every normal medical standard and convention has been thrown out, that effectively the standard of care is not based on the kind of scientific deliberation that you would imagine would have to be at the foundation, that the right to informed consent is nowhere in evidence, and that we are effectively, well, if this was a scientific question rather than a medical question, I would say something has started with the conclusion and worked backwards, which is the greatest scientific sin that there is. And in this case, it has the added horror of putting human health and well-being in jeopardy. And I'm not sure. The problem is that what I've just said seems to me quite uncontroversial, actually, just the simple facts of what we are doing. The idea that anybody would think to vaccinate children who are safe from this disease with a vaccine, even if we did not have any evidence of harm, which is not the case with these vaccines. The idea that anybody would vaccinate people who are at no risk, who have a long life ahead of them, many of whom have already had a disease that provides robust immunity, the idea that we would expose them to any risk at all from vaccines that are so new is preposterous. And yet, when I look at the explanation for why we're doing that, it's in vague, almost childish terms, right? The idea is somehow that vaccines are good and that you are doing something for your child by inoculating them without anything that looks like an adult risk-benefit analysis. So what has happened such that the interface between the public and medicine is now looks like more like PR and customer service than it does like science and medicine?
One of the most flagrant examples of what you just mentioned was recently CNN medical correspondent Sanjay Gupta appeared on Sesame Street and was with another CNN correspondent effectively seducing children into taking the COVID-19 vaccine without presenting a fair balance between the potential benefits and risks of the medical product. We have laws in place. We have pharmaceutical that Americans get a fair balance of benefits and risks. And you're right, that's been abrogated in this case. There's been a giant abrogation of medical ethics, of pharmaceutical pharmacovigilance and regulatory principles. And it's extraordinarily dangerous. I think historians will write about this for years to come. How did America go off the rails? I recently had dinner with Scott Atlas. We spoke at a symposium together, and Scott used that term over and over again. He said, things are off the rails. We're not following any of the general rules. Well, what could have been different? That was your question, Brett. What could have been different? What could have been and should have been different is teams of doctors. We should have had teams of qualified doctors working along 4 principles. And I presented this to America when I testified in the U.S. Senate in November of 2020. I said, listen, we should have had a team that was totally focused on reducing spread of the illness. Great. A separate team focused on early treatment, yet another team focused on in-hospital treatment, and then a final team focused on vaccination. Those teams should have been gathered. They could have met virtually, and they should have given at least weekly or monthly reports with evidence reviews and scientific updates. We're not having any formal evidence reviews and scientific updates in these 4 important areas called the 4 pillars of pandemic response. I ultimately published that. Well, I can tell you, if we had the right committee structure in place, and for vaccines, we obviously should have had a data safety monitoring board, a critical event committee, and a human ethics board.